Hello, and welcome to the Unspoken Medicine Podcast, the podcast that dives deep into the hidden and often unspoken truths of healthcare and its intersection into society. I am your host, Dr. Sherron Colgram, and I am excited that you came to the office today. If you are new here, welcome. We are glad to have you. If you are a returning silent community member, I appreciate you so much. I've been seeing y'all all in the social media streets just supporting and sharing. So I am so excited that you are here. Today, we are going to be talking about kidney disease and specifically chronic kidney disease or end-stage renal disease. When I thought about doing this podcast, I was thinking about the people that I wanted to bring on, and especially just thinking about the work that I wanted to do here. I knew that what we are doing here aligned with her purpose. And so I'm so excited that she graciously accepted the challenge and the invitation to come on today and share her story. She is a loving wife. She is a dedicated nurse, a patient advocate. She is a dialysis warrior. Destiny Child has nothing on her because her life is the true definition of a survivor. But most importantly, she is a child of God. And today she is going to share her remarkable story of resilience and finding purpose through her battles with kidney disease. So wherever you are, please give a round of applause wherever you're listening for this beautiful gem, my friend Lisa Meyers. Lisa.
Hi,
How are
everybody. I'm
you?
glad to be here. I am so happy to be here to share my story.
I'm
How are
excited
you?
that you're here. I'm good. Now, you have a whole bunch of letters there after your name. So tell us what the MSN stands for.
The MSN is for Master's Degree in Nursing. It allows me to teach, but I haven't taught lately. And then my R&C is I'm certified in obstetrics, inpatient OB. And the CSN is I'm a certified school nurse.
Okay, perfect. All right, so I definitely want to probably come back to all of those letters because, I'm sure there's people watching now that want to understand, what the scope of nursing is and just kind of understand, how you got into doing all of that. I wanted to just first focus on just kind of giving some like basic foundation and knowledge about kidney disease. And specifically chronic kidney disease is what we're talking about today. We know that it's a chronic and then progressive damage to our kidneys. Typically most people are born with two kidneys. And so that leads to a loss of function. But I'm not sure that many people understand the different functions of the kidney. So can you talk to us about that?
Yes, initially I didn't know too much about kidney disease, but your kidneys do a lot for your body. It produces red blood cells, it filters the waste out, controls your blood pressure. It does so many things, and you don't know it until it affects you. And it's it makes you research about yourself. I know I want to know everything that there is to know about it.
Yeah. So it's almost like a kind of like if you think of like a Brita filter, so it's like filtering out like the toxins and any excess water, like you said, the additional thing where it makes blood cells. Um, what is the prevalence in Americans? Like, what's the prevalence of chronic kidney disease?
So the prevalence is 1 in 7 people are walking around with it, and they don't even know that they have it. It's silent. It usually will affect people of color, and the key to it is that you have to be diligent with your health care, and
Mhm.
that's the way that I found out.
You were saying that people have chronic kidney disease, but they don't know about it. Like, how is that possible?
Because they don't go for regular exams. And we tend to ignore symptoms because they're just symptoms that you don't need to think about. Like looking back, I remember my urine was frothy like soap, but I didn't think anything of it. I felt fine,
Yeah.
and you don't pay attention to headaches and things like that.
Mm-hmm. And then in terms of like age, sex, and race, I know you said it's prevalent in African Americans, but in terms of like age and sex, where do people typically have it?
So they typically have it in like between 40s, age 40s,
Mm-hmm.
and it's usually men more than women because we get care more than men do.
Mm.
And they tend to ignore things, especially being the breadwinner. You just ignore it.
What are some of the common causes of kidney disease?
So the common causes of kidney disease are hypertension, diabetes, idiopathic, like you just don't know where it came from,
Mm-hmm.
drugs, antibiotics could cause it, and that's usually an
Mm-hmm.
acute renal failure, so it's able to be reversed.
Gotcha. And diabetes, you talked about diabetes, but diabetes is the leading cause of kidney failure in African Americans.
Yes, that's correct.
Now, when you talk about representation in terms of dialysis, how many of African Americans represent the population of people that are getting dialysis?
There's a large portion of us that are getting dialysis, and when you are going about your normal business, I need people to pay attention to all the renal centers, the dialysis centers that are around. The primary
Mm-hmm.
one is DaVita, and then it's
Mm-hmm.
Fresenius. But DaVita, it's a business, and
Mm-hmm.
it people once you're on dialysis, it seems like it's a death sentence, but it's actually keeping you alive, and you have to go. You have to go. I mean, I didn't want to do it.
What are some of the risk factors?
So the risk factors are drug use, ignoring your medical, not going to appointments and things like that, and if you had a family history of
Mm-hmm.
hypertension, diabetes, things of that nature.
And we usually typically get, hypertension or high blood pressure and diabetes from lifestyle choices. So some of those risk factors would be, physical inactivity or poor food choices. All those things, can eventually cause diabetes and high blood pressure, and therefore complications to your kidneys, which can lead to chronic kidney disease. So there's a host of things that we could do in terms of lifestyle modifications to prevent us from getting kidney disease. Yeah.
A diet, yeah, a diet that's high in cholesterol, sodium. You have to avoid those kind of things, and you can eat a great diet without having those
Mm-hmm.
things in your life. More
So
vegetables.
more vegetables, yes. So tell us about your journey with medicine.
So my journey started. I had just taken a walk back with my husband from dropping my car off,
Mm-hmm.
and when we got home, my ankles were the size of logs, and I just elevated my speed, and we thought it was just going to go away.
Mm-hmm.
And for some reason, black people think that they just have to go to work all the time. And so I went to work the next day, and I talked to my attending, and I said, "Hey, I'm having all this swelling," and she said, "Well, let's get a straight cath." So it's a catheter that goes in your urethra, and it gets urine sterilely. And immediately my protein was off the scale. So she referred me to a medical doctor that was a friend of hers, a great
Mm-hmm.
doctor, who in turn referred me to a nephrologist. And I had a kidney biopsy, and during a procedure, I heard someone say there's a lot of adipose tissue, and I should have said something, but I couldn't say anything. But it just made me a better nurse to watch your language when you're around a patient because I knew exactly they were saying I was fat.
Gotcha. I was just about to say, I said, what are they calling you, fat?
Yeah. Definitely.
Oh my gosh. So you get the diagnosis, from the biopsy that actually, what did they specifically say the diagnosis was when they did the biopsy?
They called it idiopathic nephrotic syndrome, membranous. So it was like a long diagnosis that just captured everything kidney. And I was managed with medication for 10 years.
And then when you said idiopathic, that is meaning that they don't really know where it came from or the cause of it?
Right. They did not know what the cause of it was. And so the only thing that I could attribute it to myself is that I had really bad menstrual cramps. When they came, I was like a demon. And I took Motrin and for the pain. I was in so much pain.
How much Motrin was you popping? How much Motrin was you popping?
I was taking 600 to 800 every 6 hours. It wasn't out of the norm what I was taking, but
yeah,
I probably had already had kidney disease, and it just probably accelerated it.
Pushed it quicker. And then how old were you when you got the diagnosis?
I was 30.
And you were already a nurse? Were you already a nurse at the time?
Yes, I was a nurse at the Medical College of Pennsylvania.
Okay. So when they tell you you have this diagnosis, idiopathic nephrotic syndrome, they said they were going to manage it with medication. Did they say it would get better? Did they say it would get worse? Like, what was the information they gave you about it?
So the information that they gave me about the nephrotic syndrome is that they would manage it with medication, and that one day it would probably progress into end-stage renal disease. And so I was managed, like they would put me on a medication, take me off because I had symptoms of coughing and shortness of breath with ACE inhibitors. And so they would switch it to something else. And I was a person that did not like taking pills. So I was on 12 different medications.
12 different medications? And then how long was this time frame? Because they said eventually you would
10 years.
10 years.
Yeah. It was 10 years, and there was a fellow that was working with my nephrology attending, and he was like a grandpa. He didn't like giving me bad news, so she did it. And she was Asian, and I really loved her. And she said to me, I was going to Bermuda. She said, "Go on your trip and have a nice time, but when you come back, we have to talk." So I already knew what the talk was going to be. I did not tell my husband. I did not tell anyone. And we went and we had a great time and came back, and I took a friend with me, and she, the fellow said to me, "Hey, your kidneys are failing, and we need to choose a mode of dialysis." And the friend that was with me jumped off the table. I already knew what was coming, so I'm the kind of person like, okay, what's next?
So good. Did you tell your friend before you went to the appointment that that's what was going to happen?
I did tell her. I said there was a possibility of it happening.
Okay. Yeah. So when we talk about dialysis, so now your kidneys are failing, they're not working. Did you feel it at all? Like before she said we need to have the talk, did you like feel that your kidneys, okay, they're not working, I'm not peeing as much, like anything like that?
So I had the frothy urine. I wasn't peeing as much, and my appetite had decreased. I had lost a lot of weight, but I used it to my advantage. I was able to fit into other clothes. So I was fly. I was a fly dialysis patient. So we get the diagnosis, and then they tell you, okay, like
where you're gonna have to do dialysis. So I was a nurse, knew what dialysis was or had some understanding of it, but like what was something new to you, or when they were saying we had to discuss the types of dialysis, did you know there were different types? Like what was your thought process at the time?
So my thought processes about dialysis, I only thought that there was hemodialysis. I did not know anything about peritoneal dialysis. And since that seemed to be like no needles, just like a tube that would be placed into my abdomen, I chose to do peritoneal dialysis.
What were the pros to doing that versus doing the hemodialysis?
The pros to doing peritoneal dialysis versus hemodialysis is that there were no needles involved. Um, I didn't have to worry about cramping. But looking back after doing both, I think I would have preferred doing hemodialysis if I knew what I knew after.
Sure.
Because with the peritoneal dialysis, I had to do exchanges initially, and I had gone back to work because you got to work, and I would do exchanges in the rooms, one of the labor rooms, and the CNO had came around one day and she said she would like to come in. I said, well, you can come in, you just have to put a mask on. And she was like so impressed, but to me, it was survival. I wanted to live. And the cons to doing peritoneal dialysis is I was like Cinderella. I had to be home by 8 o'clock to get on my machine in order to get up at 5 o'clock in the morning to go to work. So if I went to an event, it was like, I got to go. Yeah.
I'm going to turn into a pumpkin. I got to go.
Yes, I got to go. And also,
when you talk,
my stomach was
go
big.
ahead. Your
My
stomach was what?
Was really big because was large. Because the fluid was dwelling in, and I had to drain.
Yeah. How many times a day would you have to do the dialysis?
Once a day. Initially, when I started with exchanges, I would have to do 3 or 4 per day, and then I got a machine in my bedroom. And the thing, I was still urinating, so I had to either take myself off the machine or take the machine with me to the bathroom.
How big is the machine?
About the size of, I guess 50 inches.
Okay.
Yeah, it was really big.
So you just have to carry that whole thing into the bathroom when you had to pee?
Yes, but the tubing was long enough that I could sit it outside the bathroom and go in.
Okay, got you. And then when you talk about exchanges, just for people that don't understand that, what does that mean?
So it involves putting fluid in your abdomen, like your abdomen becomes a membrane, and you let fluid come in and through a tube, it dwells, and then once it dwells it sits in your abdomen for a certain amount of time, then you have to drain it, and it drains all the waste off.
And it does it like a few cycles, right? Everyone is kind of different in terms of the cycling.
It's the same thing, but you just have to do it several times a day. And
Okay,
then once
gotcha.
you get used to it, then you do it once a day.
When you first start doing it, because you said you had to do it multiple times, did they have to just kind of adjust it to see, what worked best for you?
Yes, I had to go through training, and I went through training at it was a place called Ann Preston Hall near MCP, and the nurse trained me and my husband. And once they felt that we were able to handle it, then I was able to go home and do it.
When did you tell like your family, like you got the diagnosis, but when you went home, like did you tell all your family immediately? Like what was that for you?
When I got the diagnosis, I did tell all my family immediately. My husband was extra tender, so I had to tell him first.
Mm-hmm.
And he said that this is our disease. We're going to do this together.
Mm-hmm.
And such a great man, such a great support system.
Yeah. Okay, so you do the hemodialysis. No, I'm sorry, not the hemodialysis, the peritoneal dialysis. You started with the peritoneal dialysis. Like, how long were we doing that before? Was it a decision at the same time to start to get on the transplant list, or was it like you had to start that first? Like, what's that process?
So the decision was made immediately for me to get on the transplant list.
Mm-hmm.
They felt that I was young and that, you know, I was a viable candidate. And my family was tested, and my husband was a match, and which is really crazy. And we planned to have the surgery at the end of February 2005, I believe. And I got a call that there was a kidney available for me at the beginning of February, and it was a pediatric cadaveric kidney, meaning that the person had died. It was a 5-year-old child's kidney that I was going to get, and of course we jumped at it because then both of us would not be down.
So when you got the transplant, how was that experience? Like, how was life after that?
Life after that, I was actually working at Hahnemann then. I had went to City Avenue, Hahnemann. I was a gypsy, and so life was great. I still was kind of small, but life was great. And for some reason, I had this love of Latin music. I don't know anything about my 5-year-old donor, but I was listening to Latin music nonstop, not knowing any of the words. It just made me feel so happy.
Can you speak
And
Latin now?
Poquito. But I just love the language. I should learn it.
Yes. Yeah. Mm-hmm. That's one of my goals. I need to learn how to speak Spanish. Yeah. Okay. So then, how long did you have the transplant before, anything else happened?
So initially there were problems with the transplant, and I had to get
really?
infusions of of thymoglobulin. It was a really potent medication to help my kidney. And I remember after year 3, I started feeling depressed. Just out of nowhere, and we had a boss that was in charge, and it was like she was bringing the morale of the staff down. And I went to my nephrologist, and I was like, "Hey, I'm just feeling really, really sad."
Yeah.
And he said he was going to put me on medication, and I did not get it filled just yet because I did not want to be alone. So I just drove around the city and was waiting for my husband to get off. And the doctor called me, and he said, "Do not get that prescription filled. You have to come to the hospital right away to get a catheter placed in your chest to do hemodialysis."
Wow.
And yeah. So in one way I was scared because I didn't want a catheter in my chest. I'm so vain. But it explained what I was feeling.
Yeah.
It validated what I was feeling. And I just was like 3 years, and now I'm back on dialysis, and I'm doing hemodialysis.
So I want to understand this. You're saying that the depression was your sign that your kidneys were failing.
Yes. I just thought that I was depressed from work, but it was more than that. And
wow.
That's one of the symptoms of renal failure is depression.
Wow. So you go to the hospital, you get the emergency line, and I'm assuming you get relisted at the same time. Was there a time frame in between that, or?
I get relisted, but Ty was planning to donate his kidney to
Okay.
me because he was
Mhm.
a match. But I had received the pediatric kidney and I had developed antibodies against my husband's kidney. So he was not able to donate and he was so angry. I've never seen him that angry. The transplant coordinator, she got it. She got all of his anger. And I was trying to explain to him, but I was like, you know what, just let him go. He deserves to be angry.
Yeah.
And so I just got relisted, and that year was one of the worst years of my life.
Oh my gosh.
I had developed a autoimmune disease.
Mhm.
I had this blistering disease. It's all over my body. But during that time, my coworkers at Hahnemann, they decided to get
Hahnemann.
tested, and there were 3 people that were a match.
Mhm.
But my sister friend Lisa Maletsky was the best match, and she had told me, "I'm gonna make you Irish." So it makes you feel like guilty that somebody's giving it to you, but I felt so blessed that I had people that wanted to do it.
Yeah. And we're talking about Lisa Mo. Hey, Lisa. Hey, girl.
Hey Lisa, hey Mo. I call her Mo.
Yes, we call her Mo. Wow. So you had 3 people. Lisa Mo was a perfect match. And so once they found out she was a perfect match, did we did we move immediately into getting the surgery, or what was the plan from there?
So because I was going through this autoimmune disease, and
Mhm.
also I had a low hemoglobin. My hemoglobin dropped to as low as 4.9, and I was walking with a cane, short of breath, could barely get myself together. And I remember one day I would always come up to labor and delivery, and Jane Breyer, she saw me, and she just whipped me up and threw me in a wheelchair and took me to dialysis. I couldn't even fight her. And so during that time, like I had a GI bleed. I was sitting in the dialysis unit. I had on a bright yellow neon jacket, and I kept feeling this full filling in my throat.
Mhm.
And I didn't feel nauseous, but I felt like something was there and it was going to come up. And one of the nephrologists was there, and I called him over. I said, I think something's coming up. And he got me a basin, and it was blood. I vomited a whole bunch of blood. They took me to T, had me disconnected, and I felt like my hair was whipping in the wind as he took me to the ER, and they called medicine. Medicine dropped a tube down, which that was horrible. And then I was admitted to the ICU, and that was
Why
crazy.
what why did you have the GI bleed? Like, what was the reason for that?
So the blistering disease that I had, it's called
Mhm.
epidermolysis bullosa acquisita. The
Mhm.
blisters had also gone down in my esophagus, and it ruptured.
Wow. Okay. So, how long were you in the hospital for that?
I was in the hospital for about 3 days,
Okay.
and that third day, I had had all the testing done. Everything came out fine,
Mhm.
and they were saying that they were waiting for me to go to another test, but I had had all the testing done. And I'm like, well, when am I being discharged? Because there is an OBGYN party that I need to get to.
I cannot. You're such a diva.
So I call my attending, and I'm like,
Oh
so am
my
I
gosh.
being discharged? And he's like,
Right.
yeah, everything is normal. I said, well, they're not giving me any papers. My bed is stripped. I'm ready to go. So he came over and he discharged me. And I was in no shape for a party, but I just wanted to be around the residents.
Yeah. Yeah.
And yeah, yeah. But I went.
Okay. Okay, so how did they treat the blisters, the angry blisters?
So while I was there, they gave me Benadryl and they went away. But then they came back and I was in isolation and I had to see all these different doctors, ID, medicine, dermatology, all the allergies were there.
Yeah.
And they took a biopsy of my skin, sent it away, and that's when they diagnosed that. And then there was this medical student. He just kept checking on me, and he said that he knew me. And I said, well, where do you know me from? And he said, labor and delivery. I'm like, oh my God, like, what's on my best behavior? I said, so how was that? He said, you were, he said, you were funny.
Oh my gosh.
Yeah. So he actually diagnosed it, and they put me on steroids, and it went away, never came back.
Wow. So you got diagnosed by a medical student.
Yes.
Do you know his name?
I don't know his name. I wish I used to know his name, but it just was so nice of him to come after his shift was over and ask me if I needed anything, and I thought it was the sweetest thing.
Mm-hmm. All right, so now what year was that?
This is now probably 2008.
Okay, so he's been out for a while. He's a doctor somewhere doing amazing things. So hopefully,
Yes.
if you're watching, please get in contact because you need to be reunited. That's like an amazing story.
Yes.
All right, so how did we get to, so when did you guys do the surgery? So you guys did the surgery?
So we were scheduled to do the surgery March 18th, I believe.
Okay.
And we had a party first. We had a kidney party at Alma de Cuba. And it was all the residents, all the nurses, everybody there. It's like a united family. And we planned to do this party. And the next day was going to be the surgery.
Mm-hmm.
And so we did the surgery. And everything went well. I immediately had urine coming out of my Foley, and then I just felt really sleepy. And I know it was short-staffed on labor and delivery, and Lisa was at the other end of the hall, and and I'm there. And so one of my friends had came up to check on me. As she's visiting me, she's like, what happened to the urine in your bag? And I'm like, I don't know. And then she said, something's wrong. She called the nurse in. She said, something's wrong. And she's more sleepy than usual. And you need to get the attending to come in. I mean, she was like a bulldog, and thank God. And one of the ureters had detached from the kidney, and I was bleeding into my abdomen.
Wow.
So, yeah. And the attending came in, and I remember like flashes of it. And they took me to ultrasound, and then they said that I had to go to surgery. So as I'm waiting to go in, my husband's there, and my friend that found, that I was bleeding, and I said, oh my gosh, I can't breathe because, my head was flat. And she's like, oh, she can't breathe? I said, yo, get it together.
You came out of it. You was like,
yes. No. And
oh my gosh.
I can remember Sue Kaplan. She was always around, and Marcus. And I remember hearing somebody say, you know who that is, right? It's Lisa Meyers. And I was massively transfused, intubated. And when I came out of it, I'm in the ICU, and I'm arguing with the anesthesiologist, who also rotated on labor and delivery, Lana. And I'm telling her, take this tube out. And she's like, we can't take the tube out. I said, take it out or I'm going to rip it out. And so my friend had kept trying to come and see me, and they were throwing her out. But when I woke up, they called for her to come to calm me down. And I
Mm.
was just focused on call my husband, call him now. He needs to
Mhm.
get up here. Knowing in the back of my head, I think this kidney is gone.
Mm.
And so then I wanted my soap. Like, where's my Dove soap? And tell my husband to bring my Dove soap. And well, there's no phone. I'm like, the phone is on the wall. Call him right now. And it was once they stabilized me and they were able to
Yeah.
take the tube out. Then I went up to a surgical step down unit.
Mhm.
And when I tell you the love that I was given, I had my room became a shrine of flowers, and I had random people that I did not know come in the middle of the night. Oh, such and such told me to check on you. Like, okay, I had home cooked meals, breakfasts paid for, and there was just a small amount of urine coming out.
Mhm.
And my husband, who's not a medical person at all, I'm like, Ty, there's only been 14 cc's, like
Mhm.
like this. And he said, but it'll get better. I'm hopeful that it's going to get better. And I already know
Mhm.
that a perfect kidney is now gone.
Mm.
And so I was in there for a month. They did some kind of infusions. I can't even remember the name of it, but I
Yeah.
had to go there frequently, and strong medications. And so one of the nephrologists, Dr. Bresson, he came in my room and he said, "Stop it. Just stop it. The kidney is lost. It's over. Stop letting them do these things to you."
Mhm.
And so he said, "It has to come out." And Sue Kaplan came to my room to do my pre-op. And as I get to the OR, everything that I had gone through, I had just burst into tears. I broke down, and it was like
Mhm.
she was like a mother to me. And she
Mhm.
just held me in her arms. And because I have a tendency to say, okay, now what's next?
Yeah.
And I hadn't expressed my emotions.
Mhm.
Yeah,
What were you
so
feeling though? What were you feeling at that time when you were crying?
I was feeling defeated. I was feeling, why me? This was my second chance at life. And I was angry at the surgeon because they called it rejection. And I participated in a lot of surgeries with doctors, and that's not a thing. Just tell me the truth, because I've signed consents with doctors that say may cause damage to this or this. Just be truthful with me, and maybe my vasculature wasn't perfect, and that's why it
Mhm.
detached. Say that to me, but don't tell me it was rejection.
Mhm.
And so, I had to have a nephrectomy, big scar on my abdomen, had to come out, and stayed in the hospital a little bit longer. It was a total of a month,
Uh-huh.
and start all over again doing hemodialysis.
And so were you doing the hemodialysis at home still, or did you have to go to a center?
I went to a center at Hahnemann, and I wanted ice from the 16th floor, like, and they would bring me ice from the 16th floor.
Just the 16th floor, no other floor.
No, not the 19th, not the 20th, the 16th floor.
So for y'all that don't know, the 16th floor is the labor and delivery. So that's where we were housed. So she wanted it from labor and delivery ice. Talk to me about your physician at the time, Doctor. Is it Dr. Krevlin? Am I saying his name right?
Yes, yeah, he is the best doctor in the world. He became my friend, and I was. It was just such a difficult time for me. Um, he would round on me in dialysis, and then I
Mm-hmm.
would also go to the Vita, and we had like a multidisciplinary meeting was done with each patient. And so during one of those meetings, I broke down and like this, I can't do this. I knew I could do it, but it was just too much. And he walked out of the room because I was a mess in tears. And he came back and he said, "Buddy, I'd like you to speak to a patient for me. She's going through being diagnosed with end-stage renal disease, and could you talk to her?" I was like, "Of course." And I spoke with the patient, and I'm crying in between talking to her. But at that moment, I knew that this is what God wanted me to do by giving back to somebody who didn't, because I didn't have that person to talk to me about dialysis or kidney disease. So that's what I started doing. And it's because of him that I started. And so I just, I got trained to do at-home hemodialysis with my husband. And I thought, like, oh, okay, I'm a nurse. It's not going to take too long. I know how to put IVs in. But 6 weeks later, it was training for 6 weeks. And everything had worked out because he was off for the summer, and he's a teacher. And of course, there were problems, but we had an on-call person to call. Bleeding issues, machine technical issues, but we got through it, and I did that for 10 years.
10 years. So, and then during this 10-year time, you were back to work on labor and delivery.
Yes.
Were you doing any more teaching or support, patient support or patient advocacy support with Dr. Colgram?
Yes, all the time. And I kept saying to myself, oh, I'm going to go back to school. I'm going to finish school, because I was in school at the time for my bachelor's degree. And I thought, well, maybe once this passes, then I can go back to school.
Once what passes?
Once the whole kidney disease calmed down, or, I got another transplant, and then I would go back to school then. And I was like, no, the time is now, because we don't know what's going to happen. Yeah. And so I was doing dialysis full-time, working full-time, and I did things for the hospital. I was on a lot of committees to improve patient care. I was working with the residents, and one of the attendings pulled me in to do mock drills, and I found that really to be satisfying to do. I like teaching, whatever it is. And before I came back to work, I was still visiting the unit after dialysis, and I remember Dr. Cross said to me, how are you doing, and blah, 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 and he's like, I said, I'll be back to work. He's like, you're coming back? Absolutely. I need to be needed, and I like providing care for marginalized people. I like labor and delivery. I like the footprints. I like the babies. I like the crying. I like the emergencies, all of it.
That's amazing. Just to be going through all of that, you were able to put people first, and that was something that kind of just kept you going. You know what I mean? I don't know if I would have been able to do that. I don't know, where did that come from?
I needed to be busy. I could not focus on being negative, and I had to feel like I was giving back. I did a lot of projects where one was one of the HIV patients of Dr. Lean. She was very compliant with her care, and I realized that some people, they look down, if you have HIV, then oh my God, she's a person, she's a woman. So I raised money to get her a gift certificate around Christmas time for her and her family, so she could buy food or toys or whatever. And then I found out that I was good at raising money. And one of my dear friends was diagnosed with stage 4 cancer, and it was devastating to all of us. But I knew a lot of nurses and doctors who had, graduated and went on, and I reached out to everyone that I could get, because it was important that she had a nice Christmas. Christmas for a family. And
Yeah.
I just feel like this is my purpose. And so now I'm giving back to these little kids that I'm working with.
Before we get into how you are helping the future nurses of the world, talk to me about going back to school and then also deciding to potentially try again for another transplant.
So I went back to school and I was doing dialysis and working, and I finally finished. And I
Mm-hmm.
talked to my counselor, and she said, "Are you going to come to the event tonight? We're having this event." I was like, "No, I'm going to be doing my treatment." And I got the award for academic achievement from the Drexel Nursing Program.
Mm-hmm.
And so I was like, "Well, I think I'm gonna go back for my master's." And my husband's like, "I don't think you should do it." I said, "But it's really not up to you what I want to do. I want to do this. This is for me."
Right.
And so, yeah, like I respect what you say, but I'm going back. And
Mm-hmm.
so I did, and it was difficult. One of the courses I did not pass, and I had to
Mm-hmm.
repeat it, but it was work. And the instructor said to me, "I the average that you had to get was an 84, and I had an 83.3." And so I was asking her if I could do any kind of project to get those points, and she said, "No, you're going to thank me one day." And I said, "No, I'm not. I'm just not." you know. But I went back and got an A plus in the course. It was just a difference of an instructor. Um, and I decided that my Dr. Kremlin had spoken to me, and he's like, "I think you should get listed at another place." And Our Lady of Lourdes is in Jersey. You can get listed in two different states. You can't get listed in the same state twice. So Camden was close, and I went there for my evaluation, and everything was just so positive.
Mm-hmm.
They did all the testing. I met with the surgeon, the nephrologist, the dietitian, the social worker, everyone. And they just confirmed what I had thought, that it was not rejection,
Mm-hmm.
that it was, the ureter became detached, and that they could offer me a kidney, even with my 100% level of my PRA level. That's the amount of antibodies that you have in your body. And
Yes.
so I just said, I only have one stipulation. I'm in school for my master's. Once I graduate, then I can be listed. But I don't want anything to interfere with that. I want to just get it. And
Sure.
they did. And 6 months later, I got the call.
Wow. So, two questions. One, you had went another, was it another 10 years from the second to this time before they said maybe try again? Like, no one thought before to say or suggest you going to another state to, try to get listed again? Or was that something not in your head that you were thinking to ever do?
So I was evaluated every year at Hahnemann, and no one had told me about listing somewhere else. And I just felt that because of the complication, that they were not going to give me a kidney. Because every time I went, it was always supposed to be like 20 tubes of blood drawn and talking to a team of people, and that just kind of decreased. They just drew the blood. I didn't talk to anybody else. And so when I went to Lourdes, it just was totally different. And
Mm-hmm.
I had talked to Dr. Krellin about, I don't think anything's going on at Hahnemann. I don't think they were going to give me a kidney because of the complication, and I wanted to sue initially, but it wasn't going to change the situation.
Mm-hmm.
And he he goes to a lot of different hospitals, so he knew he was a resident at Ford, so he knew the success rate. but he didn't want to step on anybody's toes, so he told me as a friend.
Sure. Gotcha. So you go there and you said within 6 months you get a call. Now, what is the average time people usually wait to get a transplant? Like, how long can you be on the transplant on average before, you potentially get a phone call?
So some people are on it for years and never get a call because of their blood type and tissue matching. It's a lot of things that go into getting a kidney transplant. And your behavior, like, are you compliant? Are you going to your appointments? Are you taking your medication? And I thought that because of my antibodies that it was going to be a long while for me. And when they told me, they said, well, we do transplants on individuals that have a high PRA rate. So, it can happen, but I just didn't realize it was going to happen that fast.
So you get this phone call. Where were you? What were you doing at the time you got this phone call?
I was home, and I got this call from my coordinator, and she said, Lisa, we have an opportunity for you to be a backup. So the backup person, if the primary person doesn't match for the kidney, then it would come to me. And she said, I just need you to stay by the phone. And so then she called me again, and she said, I need you to do a dialysis treatment. Me and my husband, I do the dialysis treatment, and then she calls again, and she's like, I need you, it's around 10 o'clock, I need you to be NPO after midnight. I'm like, okay. And I'm starting to get nervous. And then she called me at 2 in the morning. She said, the kidney is yours. You have to be at Our Lady of Lourdes by 8 o'clock in the morning. And I was
What were you thinking?
I was thinking, I can't drive because I'm too excited. And am I really ready for this again? Because I'm so used to doing dialysis. But I was so overjoyed and nervous at the same time.
Yeah. So you get the kidney. You go to Jersey. You get the surgery. The surgery, I'm assuming, went well.
Yes, the surgery. I remember them taking me into the OR and seeing a double setup. There were 2 tables set up, and one had the kidney on it, and there were several people that were on the team. And the first person that came over to me was my surgeon. And maybe it's just me, but this man has a halo around his head. He is just, you can just feel something when he walks into the room. He's so kind. And I started to cry. And he says, Lisa, you have the best possible kidney. This is, you're going to be fine. And then the anesthesiologist comes over to me. He's like, oh no, what are these tears for? We're here to help you. I'm going to give you the best anesthesia. I'm giving you an epidural, a walking epidural. So, and then when I wake up, I'm in the ICU, and I have a nurse, and his name is Mark. And I'm thinking, like, this is biblical to me because Mark is from the Bible.
Yes.
And I look over at my bag, and I check my vital signs on the monitor. My husband's sitting with me, and they were so kind when we came into the hospital just to go to admissions. Everybody was kind from the first step into the hospital. And one of the social workers said to me, she said, oh, I'm in a rush, but I just wanted to let you know that I know your situation. Your husband can stay over. He needs to be with you. And I have free parking for him, and he's staying overnight, and I have free food for him. I was like, this is like awesome. And so I'm post-op, and I didn't want to get out of bed. I just did not want to. And my husband had stayed there, and the nursing assistant came in and told him to go home. Go home, I got her. And she was like, come on, sunshine, we got to get up, and your hair is a mess, so I'm going to braid your hair.
Wait, because you didn't even have a chance to get your hair done because she had called you like within 24 hours. So it was like,
Yes. Just my hair all over my head, and it was crazy. It was crazy.
how did you feel when you saw the liquid gold after a whole decade of not peeing? Like, what did that feel like seeing the liquid gold?
I was like, girl, you are blessed. And then I was thinking, when they take it out, I haven't been to the bathroom in a long time. I was like the perfect date. I always sat on the end seat because I didn't have to go to the bathroom.
Right.
So, that was so scary, peeing. Um, when they took the catheter out, like, of course I had to walk around, but when they took the catheter out, I had to make a mad dash, and it was right there. And it was just so, I'm like, oh my God, I'm peeing. Yes. And Sherron, she came to take me home.
Uh-huh.
And when she came, I went to the bathroom right away, and then we get on the expressway, and I say, Sherron, I gotta pee again. And she said, well, I don't know what the hell you want me to do because I can't pull over on the expressway. She said, just take your mittens and put them down there.
Oh my gosh, I love Sherron. That is amazing. So, and then how long has it been again? When did you get it? What year was that?
February 21st, 2019.
2019. Okay. I remember, and I don't remember if you specifically like posted that you were about to go in or you posted after, but you put a post and you were like, I got a call. And I think it was probably like 1 a.m. I don't know. I'm up all the time because, we be working. And so I saw the post and, I didn't know all of this story, but I knew like some of it. And I was just so excited, like literally like right then I like start praying. I was like, Lord, please let this transplant work. I was like, 'cause Lisa is amazing. Like, we need this. Like, as your husband was saying, this is our disease. Like, literally, I was like, okay, this is our chance. Like, we get a third chance. Like, this has gotta work. This has gotta work. So I was super excited, when you was talking about, your first pee. I was like, people think we're crazy because we get excited when our patients pee and poop and pass gas. Like, we were so happy. But I was like so happy. I was so happy. I was like, oh my God, thank you, God. So I'm just super excited that we're going strong, since 2019. That's amazing. Now, have you had any issues since then, though?
I had an autoimmune skin disorder, and it's rare, but my dermatologist, who I've had for years, she put me on a compound medication that had to be made, and it went away. And what else? That was it. Just changing medications, and also I developed diabetes because I had to take prednisone for life. That was the recommendation, along with anti-rejection medications.
Yeah. How many doctors do you have now, like that you have to see on a regular basis?
So I have, of course, my OBGYN that I have to get a pap smear every year. I have my nephrologist, Dr. Krevlin, and I see him every 6 months. It's actually every year. So I see Dr. Krevlin, and I also see the nephrologist from Lourdes. I see a dermatologist. Who else? I have to get colonoscopy. So I was seeing a GI guy, but I don't see him anymore. And I was seeing an infectious disease doctor, and I don't see him anymore. And I was also seeing a hematologist because they had to find out why my hemoglobin was so low. So they do biopsies, and then the hematologist is like, well, now we want to take a piece of your bone. I'm like, no way, no, you figure it out, but you're not taking a piece of my bone.
Yeah.
Not today.
Oh my gosh.
And she calls herself numbing me up. You can't numb bone. It hurts. Mm-mm.
Oh my gosh. So you told us a little bit about your supportive village, but what did it mean to you to have all of these people, especially, this has been a long time. This has been years, but what does it mean to have a supportive village, especially when you're going through some type of chronic disease?
So it meant the world to me. All of the people in my life that supported me from day one, that's still there in my life supporting me. Um, I kind of imagine God saying, well, who is this Lisa? Because I'm getting all these calls from people to pray for her and help her, and I just feel lucky and blessed by all
Mm-hmm.
the support. Um, People have always been there. They think that I'm amazing, and I'm like, I'm just doing what I'm supposed to do. I'm being the perfect patient with an attitude. Um, and I don't consider myself like they're like, oh, you're really strong. And I'm like, no, this is what I had to do. And if you had to do it, you would be strong too. I'm. It's called perseverance. It's called doing what you have to do, and being good to yourself.
Yeah. As a patient, you, like you said, you had a lot of people that were supportive that are around you. Was there anything that you wish that you did have, whether it was from like certain family members, was it from friends, whether it was from doctors, that you wish that you had, which would have changed, the dynamics of what was happening with you?
So in the beginning, when I first was diagnosed with kidney disease doesn't have a look, and people assume that because you look good, there's nothing wrong with you. And I got that from a few people. One of my coworkers said, you just sit in a chair and do dialysis. It's really nothing. And I just restrained myself because, Lord forgive her, because she knows not what she does. Because I was ready to snap, but it was like, it's not for me to teach you what I'm going through.
Mm-hmm.
This is mine, you know. Um, Family, I don't think they knew as much of what I was going through as well, because I kept it to myself and some of my friends. You know, people had wondered like, why didn't you have a child?
Mm-hmm.
I was going through too much to have a child. I could not imagine chasing a baby around on dialysis, and I
Mm-hmm.
don't think that would be fair to my husband to do that. And I had gone through a lot of GYN issues, and
Mm-hmm.
so bleeding and cramping, severe cramping, and I had a UAE, uterine artery embolization done, and a
Yes.
ruptured ovarian cyst, and once I had the UAE done, then I stopped having a period, and I guess that was around age 35. So I had
Mm-hmm.
already been going through a thing before the kidney disease came along. But
Yeah.
it's not like I was going to walk around with a sign like this is what I'm going through, you know.
Right.
So
Right.
people
Right.
just
Right.
don't understand.
Yeah. And I think that's good to say, because I think, we need to be a little bit more passionate, a little bit more gracious, especially when people are going through stuff, or you don't see them at work. You're like, oh, why is she not at work? Why is she using her FMLA for this or that? Like, you don't really know what people are really going through. They probably could have got a diagnosis that, okay, yeah, you might only have a few more years left to live, and so, you focused on them not being at work, but they trying to figure out, okay, well, I only got, a few more years to live. Like, what am I gonna do? So, I think it's just I appreciate you answering that, because I think it's just a good lesson to learn that we should just be mindful in terms of what we say to people. Can we talk about all things Hahnemann 16th floor?
Oh my God, yes we can. I can talk about Hahnemann all day, every day. Hahnemann
The
is a
good, the bad,
magical
the
place.
ugly. It
Oh
is.
my gosh. It is a magical place. I've gone through several sets of residents
Yes.
that have become like family to me.
Yeah.
The last, like we should have did a comedy tour, right? Because we were funny, we were funny, and we did hard work at the same time.
Yes. Yes.
There's so many stories.
Yes.
I remember like Sadana. Sadana is a crazy fool, and she had been playing jokes all weekend. And I hear this person screaming, and they're bringing her around the corner. And I said, Sadana, stop your BS. Well, it was an Asian patient getting ready to push a baby out, and it was twins.
Oh my gosh.
Yes. But the learning that took place, it's just nothing, no place like Hahnemann. The midwives and the attendings and the residents, like we all came together as a family. And I hear from other hospitals, they don't commune together. It's separate areas.
Yeah. Mm-hmm. I mean, it was almost like trauma bonding, because like you said, we saw a lot of stuff. And, you're away from your family. Like, literally, I saw you guys more than I saw my own family or talked to my own family, because once I got home, I was asleep. Like, sometimes I didn't even eat. I was so tired. People ask me now in terms of, like, they see how I practice, and they're like, so, like, where'd you get that from? Because I'm always, like, respectful to the nurses. I'm having a good time. I'm trying to make sure, the place is lively, that I just keep everybody in a positive mood. Like I said, as you said, we see a lot of things. We see people in vulnerable situations, critical situations. And so I attribute that all to my training. Like, you guys, as the nurses and as the midwives, I felt like you guys ran labor and delivery. Like, the attendings were there, but as the intern, we were like stuck hip to hip to the midwives, and then you guys were on us, like, okay, this is what's happening. You need to go here, you need to go there. So, as I said, I always attribute, my midwifery style of taking care of obstetrical patients. I attribute that to you guys, and they don't make them like y'all. I don't know. It needs to be studied. Like, HUH needs to be studied, because it was amazing. And then I also wanted to say, like, you guys took care of me. As I said, I was just so far away from home, and as I said, the good, bad, and the ugly, was a lot of stuff happening, even though we had good times, there was a lot of other foolishness happening, but I felt like I was always covered. You know what I mean? Like, you guys would see stuff and be like, no, girl, you good. And then you used to bring, I don't know if you remember, but you used to bring cherries, like, during the season. Yep. And so you used to bring cherries, and, when you see me, be like, hey, like, I brought some cherries. And so I just, like, you probably brought cherries for everyone, but really I thought, like, she brought cherries for me. Like, I'm that special that she, like, cared enough to be like, hey, go get some cherries. And before you shared cherries with me, like, seriously, I never had cherries before ever in my life. Like, we didn't have money to get cherries. So, like, and I never would try new things unless somebody was like, oh, okay, try it. So it was like it was like just more than, girl, eat some cherries, like, eat some of my lunch. Like, it was just way more than that. So, and I never told you that, but I was like, I really appreciate you. So I wanted to tell you publicly in front of the whole world, how much you mean to me. So, and I love you so much.
I love you too. I just tried to, like, picture myself being away from home, and you guys, I couldn't imagine you dealing with our attitudes and you're away from home. So I would always like share my lunch, and then back then I had now laters, and I just share what I had. And the biggest thing that I shared was my hugs. I would
Mm-hmm.
take some of you guys in a room and like, what's wrong, and don't let that person get to you, and you got this, because you needed it, you
Yeah.
know?
It was a big hazing experience, residency. Like, it was crazy sometimes. It got crazy. But now, like, Hahnemann is closed. And were you there when it closed?
Yes. Um, I went back to work. I had the transplant in February, and I went back to work in May. And I
Mm-hmm.
had an interview at Jefferson as an instructor.
Mm.
And I was like, let me call Dan Guilfoyle, because Dan will know the tea. And I said, Dan, are we closing? And he's like, I don't think we're closing. I think Joel's just playing hardball. And I just didn't want to believe that the city and the government would let this
Mm-hmm.
place close. I mean,
Yeah.
if there are 2,500 people, residents, and supportive services, that they would let it close. And, I was getting all the rumors. So when I came back, I was wondering, can I do this? Can I be, can I work for 12 hours on my feet?
Mm-hmm.
And I was proud that I was able to do it. And I just saw like the patient caseload started dwindling, and I came in from home because they had an announcement to make, and people had already been calling me,
Mm-hmm.
and they said it. And my husband's like, they're not going to let it close, the mayor and this, to that, and we fought with the union, and when they made the announcement, I was devastated. I'm
Mm-hmm.
still devastated
I
because
know.
I would have retired.
Yeah.
I would have retired at Hahnemann. I mean,
Yeah.
I was like the mayor. Everybody knew me, and got along with people, administration, and I just did not think it was going to happen.
Mm-hmm.
And
So how did
yeah,
you get into the school district?
Colleen Kramer was already a school nurse, and
Mm-hmm.
there were other nurses who had already gone. And she got me an interview, and I went and I got the job. It's totally different than labor and delivery,
Mm-hmm.
but triage will prepare you for school nursing. Um, I had to learn new skills all over again about immunizations and calling parents and dealing with parents. Um, but initially, I hated it. I'm like, these little kids away from me, like. But now I absolutely love what I do, and I get a
Mm-hmm.
chance to coordinate care for immigrant parents. Um, I have documents translated in several different languages so that I can connect with them. And the kids, I've done 8 Donors Choose projects, and I have all kinds of toys, and they come in and they feel calm. And my office is a welcoming space the way it's decorated. So
Yeah.
I'm happy what I'm doing.
That's amazing. So earlier you were talking about giving back to the future healthcare professionals. How are you doing that in the school system?
Lisa Simpson, she worked night shift. And one morning I woke up and I saw her on the news, and she was with these kids that she was teaching. And it's called the Mini Nurse Academy.
Mm-hmm.
And it's sponsored by the Southeastern Pennsylvania area nurses, black nurses. And so I took an interest and I joined their organization, and I've done it for 2 years. And we teach little kids from grades 3 through 6. Now we have eighth graders how to be nurses. So they learn how to check a heart rate, pulse ox, CPR, stop the bleed. They are
That's
learning
great.
valuable skills because we need somebody to replace us.
Absolutely. That's
Hmm.
amazing. But not only, I think, just for, future career, but also some of these things they may be able to use even at home. If something happens to an adult or something at home, it's easy. They already know how to check a pulse. If they got to call, 911. There is some of these skills that you're giving them that they can absolutely learn. CPR, like, I think everyone should learn CPR. So I just think that's amazing. Now, challenges of being immunocompromised, but also working in the school where there's germs everywhere. I'm the germaphobe, so I'm always thinking sanitizer everywhere. Like, how do you deal with that?
Um, so how do I deal with germs? I've had pneumonia twice, and I mask. I wipe my room down. I have an air purifier. Um, and I had COVID with long COVID syndrome.
Mm,
Uh, yeah, that was horrible. I couldn't breathe well. I had to use an inhaler. It, and we all got it from the same person.
mm.
I just wanted to eat my lunch, and this person wanted to come in and talk to me about something, and he had that little half mask thing going on, and I'm like, and I was so greedy, I needed to eat my lunch, and the next thing I was like, I'm like, oh, let me test myself, and it was initially negative, and then I
Mm-hmm.
tested again and developed a fever, it was positive, and so I was out of work for a month. I
Oh
could
my
not
gosh.
function.
Mm-hmm.
So when I hear like knock, knock, knock on my door, because I tell them some still walk in my office, and I'm like,
Mm-hmm.
excuse me, leave my office, go out, close the door, and knock, because I wouldn't come to your house and open your door. And so that gives me my opportunity to put my mask on, and
Right.
I have a KN95 and N95 mask.
Yeah. So we've been, you've had this kidney for a few years now. How do you how do you quiet that voice? Because you're human. So, like, how do you quiet that voice of potential doubt or anxiety that, what if, something's going to happen to this one, like, I'm still kind of just waiting for that day, you know what I mean, to have that frothy urine or, you know, shortness of, like, how do you combat that? Like, what do you do?
So the way I quiet that voice is I live in the here and now,
Mhm.
and what is for you is for you. And if I have to, go on dialysis again, I'm just going
Mhm.
to do it with the skills I already have. But I'm still going to
Yeah,
live my life because I think God has given me a purpose.
absolutely. Yeah. And you're doing so several other things just to keep you busy now. I know you to be a influencer, and so you used to do restaurant reviews. Are you still doing that in Philly?
Yes. So the restaurant reviews came from steroids. Steroids
Tell me
being
more.
so when I first started on steroids, and this was from when I had the skin disorder. They put me on steroids.
Mhm.
I wanted a pie, but did not know how to make it, and I made it. Um, I just I would make these crazy dishes, lamb with rosemary, and this all this stuff just came from my head, and it
Mhm.
was food and cleaning. And then, in order to avoid depression, Ryan, Minda, and all those girls, they made sure that I went out every 2 weeks. I was booked and busy. And so that started my love of food. And
Mhm.
now I just like going to different restaurants and checking them out. And this company contacted me, and it's called Influencer. And so they send me things every now and then for me to review. Um, One of the latest things I got was a cane, and I actually needed it because I just had an injection in my knee. So, and it's a blue cane. Thank God for that.
Perfect timing.
Yes.
Oh my gosh. Oh, that's too funny. Okay, what else are you doing?
So I'm still with the Mini Nurse Academy. They're getting ready to
Mm-hmm.
graduate next Tuesday.
Mm-hmm.
I'm doing the influencer stuff. Reading. Um, I was thinking about getting my certification, national certification in school nursing, but I'm not doing that. Like my
Mm-hmm.
husband's like, it's time for you to just relax, and so
Yes.
that's what I'm doing.
Awesome.
Hmm.
Have you guys done any trips or anything like that?
Not lately. No, not lately. We haven't,
No.
but we plan to.
Okay,
Hmm.
good. All right. So I think it is time for our silent prescription for today. So, silent prescription is basically what are the key takeaways that we want our audience to have from this conversation. And I want to focus it on prevention and like management of your end stage renal disease and transplant. So, can you speak to those topics in terms of talking to patients, talking to doctors, and then talking to family members of those patients?
As far as talking to patients,
Mm-hmm.
you know your body. You have to get regular scheduled checkups. For women, you have to get your mammogram. For men, you have to get your prostate exam. And I try to schedule things the same. I don't walk out an appointment unless I have another appointment.
Mm-hmm.
As far as doctors go, one of the quotes from Dr. Krevlin is, "Don't chase the numbers, look at the patient." It's
Mm.
not all about the numbers all the time. And learn how to speak to your patient so that they understand what you're saying. And as far as your patient, if you don't know what your doctor's telling you, do not let him leave out the room or her
Yeah.
unless they can break it down for you.
Yeah.
Um, Management of your disease. I bought these medication containers from Amazon. The container has a dose for morning, noon, and night, but it's for 2 days. So I have about 14 of them. So my medication, I have like 26 days worth of medication.
Mm-hmm.
You should not be rushing in the morning to get them together because that'll make you miss a dose of something. I also have timers on my phone, and I have my whole medical history in my notes so that all the doctors I see, they get the same thing. There's nothing left out because it's kind of hard to remember, and they don't want to know. Oh, I take the white pill. No, you should have the name of your medications, the time you take them. Um, what else? You asked me something else as well.
Oh, let's see. So you're talking about management of, of your medications and making sure you have timing. I said I talked about like what would you tell family members? Like how can they show up for or be advocates for their family member that's going through a chronic disease?
For family members, I would say to them, care without judgment and try to learn about your family member's disease. If you can do that, that would make your sister, brother, cousin feel so much better. Do not judge just because you don't see it. You don't know the private hell that people go through with chronic diseases. And ask them what they need, or just do it. Just do it from your heart. Buy a bunch of flowers to say, "Hey, I was thinking about you."
Mm-hmm.
It's little things that matter.
Yeah. What would you say to the person who is dealing with a health challenge but still wants to pursue their personal or professional passions?
If you're dealing with a chronic disorder and you have dreams of um, entering into a profession, do it. There's just nothing that's saying that because you may be disabled that you can't do it. I'm
Mm-hmm.
living proof. Like you have to just go for your goals And even if you do it one class at a time, which is what I did, you still do it. Don't let, sometimes you can kill your own dreams with the what if syndrome. Don't
Yeah,
do it. Just go for it. One step at a time.
absolutely. So, if I could give you $1 million to change medicine, what would you do? And if I could give you $1 billion to change the world, what would you do?
So I would change for $1 million. I've always wanted universal patient portals where everything crosses over, so that like if you come in at 2 o'clock in the morning, we can boop 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 pull you up, and she has this or he has
Mm-hmm.
that. If you could give me $1 billion to change the world, um, I believe in kindness. Everybody can just be kind to one another, because the world that we're living in now, it's just it's it's horrible how people treat each other, especially with our elderly people. I meet a lot of, for some reason, they are attracted to me, and they're kind of overlooked sometimes. Just a
Mm-hmm.
conversation. I mean, you get to learn like how they lived, what they did before they retired. And I told this one woman, she asked me if she could sit down, and she was in line, and I said absolutely. I said, but listen, what you should do is every time you go into a market, just get a card. You can lean on your card. She's like, okay, thank you, baby. I love talking to older people. I
Yeah.
do. And
Oh,
little
$1 billion.
kids,
Little kids,
mhm,
what would you do for little kids?
to know that they're understood.
Mm-hmm.
There's little kids that have ADHD, or they're just unsure about things, and they're very anxious. And tell them all the positive things that they bring to the table. They need to be told, they need to be held, they need to be loved, they need to play. They just need to know that they're valuable. They're gems in our community, and we need to nurture that.
Absolutely. Ooh, I like what you're gonna do with the money. Hmm, that sounds
Oh
good.
yeah, yeah, yeah.
Now, I knew you were saying something about like you were thinking of writing a book about your life.
Yes.
But I was actually talking to my mother yesterday, and I was like, I think we need to have a movie. Like, how many people, get three chances, you know what I mean, to start their life over, and all the different things, the inner working of, working with different doctors as your healthcare providers, but then as your friends, and how they save your life. Like, just imagine not having these type of people that are like looking at the Foley bag or looking at things could have been completely different. Lisa Meyers could have been dead a long time ago, but because of you having those connections and being aligned the way you are, like, you're here today on this podcast sharing with the world, you know, um your life story. So I was like, Mom, we just need to do a movie. So we need to, talk to a few people and get them to produce your movie.
Oh wow. I started writing a book, but some memories from childhood are kind of painful. So then I
Yeah.
stop, and then I
Yeah.
pick up again.
I don't know. We'll see. Maybe the book we can go that far back, but maybe like the movie we don't have to go that far back. It could just start on labor and delivery, and we're already characters. Sadana, Mo. We could
Oh
actually
my gosh,
just be
yes,
the characters
yes.
in the
Leslie
movie.
Ann Jones. I cannot even be like, I can't imagine going to like a funeral with her.
uh
She We just feed off each other silly laughs. She just makes me laugh.
Yeah. People gonna be mad at us because I mean, I'm gonna have a lot of people on here from Philly, from Hahnemann, so they could be mad at us because we could be talking about labor and delivery on the 16th floor at Hahnemann for a long time. So y'all just be mad.
Yeah, just get over it. Just get
Just
over
get
it.
over it.
Yeah, it was the place to be.
I know. My heart is so full. I am so grateful that you let me share you with the world. And thank you for just being such an inspiration. And just the beacon of life in terms of showing us like what healthcare really truly stands for. So I just appreciate you being here today.
Oh, I like being here, Kat. We go back. We have history.
We didn't even tell them why you called me Guh. I completely forgot about that.
So one day you walked up and I just couldn't remember your name. So I called you Kat. Hey, Kat. Hey, Kat.
End the story, y'all. That was it. But since then, I've been Guh, and she's been Guh. So, G-A, that's it. Oh, my gosh. Oh,
that's it.
Thank you so much, Lisa. I'm so glad you came.
Oh, you're welcome.
All righty. Let's see here.
All right.
All right, guys. Thank you so much for showing up today and listening to this episode. If you have not subscribed yet, I don't know what you're waiting for. Please hit the bell to be notified on YouTube. And again, thank you for all the listening ears that are watching on all different platforms. I appreciate you so much. Today and every day, let our actions speak to the good medicine that lives inside of us. Be well and be blessed. See you next time. Bye.